guys, and welcome back to this segment on our channel called Answering Your Most Google Medical Questions by How to Gastro, and today's video is a super interesting one. So let's get started. So in today's video, we'll be exploring the question, what are 10 dangerous health risks of tattoos? So tattoos have certainly outgrown its bad reputation. We no longer live in a world where tattoos are only seen on mob bosses, zealous religious practitioners, and hardened criminals. And today we live in a society that has slowly accepted tattoos as a work of art. With that said, it comes as no surprise that practically anyone from any walk of life has at least one tattoo in this energized 21st century age. So studies have shown that approximately 38% of the worldwide population have at least one tattoo. What's more is that most people aren't satisfied with just one, and among the stats of tattooed people around the world, 1/4 have one tattoo and about 3/4 have 2 tattoos or more. So here are 10 dangerous health risks of tattoos. Number 1 is an ink allergy. So tattoo ink contains several ingredients and chemicals, and you may be allergic to any one of them. Substances like iron oxide, mercury sulfide, ferric hydrate, aluminum, and manganese are only a few of the ingredients that may be included in the ink, depending on the color. An allergy to any one of these substances can cause a severe allergic reaction once the ink gets into your skin. Signs and symptoms of an ink allergy include redness and swelling, intense itchiness, localized pain, tiny bumps, scaly or raised skin, blisters which may open up and leak, a loss of skin color, and tissue scarring. Number 2 is an MRSA infection. So skin infections from tattoos don't happen very often because most tattoo artists around the world take the necessary precautions to prevent infections, including sterilizing equipment, wearing gloves, and using new inks and needles for every customer. But sometimes a staph infection may set in, with some individuals who do get a tattoo. Methicillin-resistant Staphylococcus aureus, also commonly known as an MRSA infection, is caused by a type of staph bacteria that's become more resistant to many of the antibiotics, making the infection very difficult to treat. So staph infection symptoms range from mild, small, itchy skin infections to serious, deep abscesses, which may even require medical drainage. So number 3 is a hepatitis C infection. So getting a tattoo requires your skin to be pierced by a needle and injected with tiny amounts of ink. The bigger the tattoo, the more injections you'll need, and each injection brings the needle into contact with your blood, and only once is needed for a disease to spread. This isn't a problem if the needle is brand new and has never come into contact with any infectious agents. But in some cases, artists may be using used needles contaminated with the hepatitis C virus. The hepatitis C virus, which is also commonly known as HCV, is an infection that spreads when blood contaminated with the virus enters the bloodstream of an uninfected person. Hepatitis C causes liver inflammation and sometimes leads to serious liver damage and even cancer of the liver. Number 4 is an hepatitis B infection. So hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic liver disease. The virus is spread by direct blood contact, so getting a tattoo poses a risk of infection if the equipment is not single-use or has not properly been sanitized, preferably using an autoclave. So just like hepatitis C, the hepatitis B virus also causes liver inflammation and sometimes leads to severe liver scarring, which is called cirrhosis, cancer of the liver, and sometimes even death. Number 5 is HIV. So the human immunodeficiency virus, also commonly known as HIV, is also a bloodborne disease that is transmitted by blood contamination in cases of shared needles and non-sterilized equipment during the tattoo process. So according to the Centers for Disease Control and Prevention, the risk of infection of HIV through tattooing and piercing is very low, but has occurred in a few cases around the world. Statistics have shown that there is approximately a 0.2 to 0.4% risk of transmission of HIV during the tattooing process. Number 6 is cutaneous tuberculosis. So cutaneous tuberculosis, also known as skin tuberculosis, occurs when the Mycobacterium tuberculosis reaches the skin. The pathogenesis of the inoculation cutaneous tuberculosis requires a break in the skin through minor abrasions or injury, allowing for the entry of the tubercle bacilli. So skin TB can also cause certain rashes, including erythema nodosum, which is a red lumpy rash on the legs, or lupus vulgaris, which gives lumps and ulcers. Number 7 is granulomas or nodules. So granulomatous and nodular reactions from tattoos are thought to be an acquired hypersensitivity reaction to the metallic ions in the pigments and occur in the deeper dermal layers of the skin. These reactions may even appear several months to years after the initial tattoo application. Number 8 is tetanus or lockjaw. So tetanus, which is also called lockjaw, is a serious infection caused by a bacteria called Clostridium tetani. This bacterium produces a toxin that affects the brain and the nervous system, leading to stiffness in the body's muscles. If Clostridium tetani spores are deposited into the skin during the tattooing process, the neurotoxin interferes with the nerves that control the muscle movement. Number 9 is dermatitis. So contact dermatitis is another possible complication from getting a tattoo, and this is a type of eczema that occurs when an irritant comes into contact with your skin, causing it to itch. So itchy skin from the contact dermatitis may then result in a red rash, and in severe cases may even cause your skin to blister. And finally, number 10, which are keloids. So keloids are raised scar tissue that can grow up to 12 inches in size. They can occur when the skin heals from an injury and are often much larger than the original injury. If you know you are prone to keloids, you should probably avoid getting tattoos altogether. And if you really are set on getting a tattoo with keloid-prone skin, ask your artist to first do a test. They can do a small line or a dot that is close to the color of your skin tone, and if no keloids form when it heals, it then means that you are able to get a tattoo in that area of your skin. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care and thanks for joining me today as I explored the 10 dangerous health risks of tattoos.